Among military veterans with significant low back pain, spinal stenosis is a common finding on MRI studies. In this video, I'll explain what spinal stenosis is and why it can be common in former service members. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help military veterans by writing Nexus letters that argue your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Spinal stenosis is a condition in which the space in the spinal canal, the space for the spinal cord, is too small, and it results in abnormal pressure on the spinal cord and the nerves that come off the spinal cord. Now, it's typically something that develops as the result of wear and tear changes in the spine related to arthritis and maybe some degenerative disc disease. Other risk factors, if you look through the scientific and the medical literature, that increase the risk for spinal stenosis would be things like obesity, smoking, sometimes a very active lifestyle, but it can be genetic factors as well. There's still some basics that we're trying to figure out about that. But spinal stenosis is a very difficult problem in terms of what symptoms you typically have. Initially, at least, a lot of times people don't have many symptoms, if any at all. They're completely asymptomatic. They're getting narrowing of that spinal canal, but they're not having that much pain. Sometimes you may have low back pain, especially progressive low back pain, but when it starts to become symptomatic, you get things like tingling and numbness and muscle weakness, a lot of times down one leg. And the symptoms typically get worse over time. Those symptoms eventually become debilitating, severe leg pain, very significant difficulty walking that make daily activities very, very difficult. Now, we see this in the military, again, very often, not so much because of a specific injury that occurred in the military, although there can be, but it's usually repetitive events, repetitive demands over time. Maybe hard landings from parachuting, and doing that over and over. The ruck marches, the carrying heavy weights for day after day, year after year, that may not have caused low back pain initially, but progress over years and sometimes decades. And so as an orthopedic surgeon that writes Nexus letters, a lot of times what I'm arguing is, yeah, maybe there wasn't a specific injury that occurred in the military, but all the physical exams that you or physical demands that you tell me about, again, the hard landings, the ruck marches, the carrying well over 100 pounds for your various activities, the physical fitness training, all of it may have led to low back problems that progressed in the years after you got out of the military. And then depending again on what MRI studies that you've had show, if it shows spinal stenosis, that might be one of the conditions I argue should be service connected to your military career. Now, if you have ideas for topics for future videos for this channel, whether it's injuries, risk factors, the specifics of the process of Nexus letters, DBQs, really anything else, leave those in the comments below this video. Make sure to subscribe to my channel, click the bell to be notified when I release a new video. If you are interested in a Nexus letter for your injury or condition, click the link in the description below this video and you can learn more about working with me and my team. We do everything we can to make the process simple, to make it as quick as possible for you, and I strive to write a Nexus letter that gives you the best chance of success in your disability claim. Thanks for watching, and I look forward to helping you.